the world changes quickly and everyone can have a voice. And once everyone starts having a voice, you start realizing that what's true about health and what you've heard about health are not necessarily the same thing.
Welcome to Back to the Future podcast. My name is Victor Sadia, and I talk with brilliant minds and hearts of people who want to uproot and transform the current health and wellness paradigm. Good morning, good afternoon, good evening. Today we have James Maskell. James Maskell is one of the most important voices changing the health paradigm in the world. He's a serial entrepreneur innovating at the intersection of functional medicine and community. Maskell is an international speaker and has appeared on TEDMED, Huff Live, Later Future, and TEDx. His two revolutionary books have motivated and guided hundreds of professionals to enter what he calls the evolution of medicine. So James, I'm always curious about how the whole of your career started. Could you just tell us a little bit about the first years?
Yeah, so I was the weird kid at school that did natural health. It was kind of forced upon me by my parents. I was the only kid in school that knew what a chiropractor was. I was the only kid actually who parents, it was like on a piece of paper by the phone at the school saying James's parents must be called before antibiotics. And this was in the 80s. And so, my parents didn't really have any medical training, but they had, subscribed to this kind of care. And I was just forced upon me. And I didn't realize that it was abnormal until I got to school and realized no one saw the things that I saw. And then I had a sort of rebellious phase. I went into doing economics, and I did my degree was in health economics. And I started to see very clearly just sort of the things that were driving healthcare costs and some issues that seemed somewhat insurmountable. And I just kind of realized that there were things in my childhood that were different, that were not sort of like old rituals, but new ways of thinking about what could be. And so I just decided after a year thinking that I needed to be an investment banker out of university, I quit my job, I moved to America, and I started working in healthcare, working at a clinic that was really focused on chronic disease reversal. And that was the beginning of the journey to understand what was happening and how we could get more of it.
What called you to health economics?
I did economics. I'd studied it before university and in A-levels, and I was good at it. I think the health was just an interesting thing that I was, the lecturer was good, but there was a part of it that just sort of resonated with me, particularly with one microeconomic. So the first year, everyone takes all the same training in economics, and then second and third year, you can sort of go a little deeper into subjects that you're interested in. So I love my microeconomics teacher, and he taught food economics in the second year. And also, this concept of negative externalities or externalities on health, I was also aware at the same time of, even in my own health issues being caused by external factors. Actually, I haven't really talked about this before, but it is true that I used to play a lot of cricket, right? It's an English game. I was really good at it. And I used to play it every day during the summer for 6-7 years on end. And part of that game, which has actually just been outlawed now because of COVID, is that you lick your finger and you wipe it on the ball and you rub it because you want to try and get one side of the ball to be shiny or not. Well, on all of these cricket pitches, there's a lot of pesticides and herbicides and all these things being used because they want to create the perfect kind of green carpet. So I did a test when I was like 20. I came over to some friends in Georgia who were in the integrated medicine world, and I ended up taking a heavy metals test and seeing that my pesticide levels were off the charts because I'd just been doing this nonstop for 7 years. So that was the first thing that really hit me, where they were saying, oh yeah, pesticides have an effect on your health. This is like the year 2000. And so I was kind of hooked. And then now I'm sitting in health economics and going, oh yeah, the environment might be contributing towards health costs. And I'm like, okay, I just saw that for myself. So it was all just like, it started pointing me towards things, and it really took a moment of me just sitting back and having a moment to really reflect on what I wanted to do with my life. One of my mentors gave me a great piece of advice, said, you should be at the bottom of a ladder that you want to climb.
Okay.
And in the investment bank, I could see what the people above me did, and it looked terrible. And so I just decided that I was going to just get involved in health creation. I knew I wanted to make my own stuff. I was creative. I wanted to have my own company. And so the journey to there was via working in a clinic. And then I started doing sales, selling to doctors, doing different forms of chronic disease reversal, integrated medicine, lifestyle medicine, functional medicine, and those were sort of like my entry point into really understanding, what's happening when people are reversing their chronic illness. Like, is it possible? How is it possible? What diseases get reversed? What are common factors across all diseases? What are unique factors to certain diseases? What are unique combinations of root causes for certain types of diseases? And that was sort of a journey that took me, up until today.
And at that moment in time when they were talking about the possibility of reversing chronic disease, how does that conversation has changed in the last decades or so?
Well, I think a lot more people realize that it's possible, right? If you go back 2005 to when I'm working in this clinic, there was nothing really about this. You had Mercola had his newsletter. There was no social media. You have to remember, right, that pre-social media, everyone got their information from basically one or two sources. Right, mainstream news, which today doesn't still doesn't, figure any of this information. The only way that this information has got out is because in the world of social media, people talk to each other, right? And so my lived experience is relevant to you, whereas my lived experience only transferred to you in one-on-one conversations or in groups. And, one person's lived experience was not science. I think that in the last 15 years, what you started to see people talking to each other and groups of people who think the same getting together and validating their own experience. And so ultimately, the information has traveled. That's been backed up by new science. That's been backed up by a slew of books and podcasts and summits. And I remember listening to the first podcast that I ever knew existed was in 2005. Ricky Gervais did a podcast. I just moved to America and I loved it. And I was like feeling homesick for leaving England. And that was the first time I heard a podcast. It took me 9 years to start my own. And here we are, 15 years later and just the other day, Joe Rogan's podcast, $100 million to Spotify. So, the world changes quickly and everyone can have a voice. And once everyone starts having a voice, you start realizing that what's true about health and what you've heard about health are not necessarily the same thing.
You came from a world that typically was thought outside of health in general or making an impact in health. We don't see many economists there. How were you received when you had all these dreams of being part of the conversation and facing doctors and health professionals?
Well, I only just really kind of outed myself as an economist with my last book because that was actually the original thinking was like, how do you get the cost of healthcare to go down? I didn't really talk about that for 15 years. At first the first 7 years was just learning. I was running a clinic, I was selling, and I realized very quickly my experience in running a clinic I realized that I knew something that doctors didn't, which was how to organize and run a practice delivering this kind of care. Because it just so happened that the first clinic that I worked in was like the best run clinic I've still ever seen. Operations manual 6 inches thick, they had so much experience running day spas that they had every process documented. And when I went into every other clinic when I was selling to those, no one had this. So that's when I just realized, okay, I've got an advantage here. And beginning in 2010 was the first time that I spoke in front of doctors as like a practice management teacher. And I was talking about how to market your practice, but more importantly, I was talking about how to use the internet to create efficiencies in a practice that would not be obvious if you didn't have those tools. So touching things like education, touching things like, internal systems. And so that was sort of my positioning. And that's how I got doctors to know, like, and trust me because I was helping them with some of the more cumbersome parts of running a medical practice that, they didn't really know how to do.
And what was your first contact with functional medicine?
So I was a sales rep, and for 3 years, I didn't go to any other conferences apart from the ones that I put on. There was no budget. I was hustling and I would put on my own little conferences in tiny hotels in some of the, worst places in America, like Stamford, Connecticut, if you've ever been there. And then in 2010, in January of 2010, I had just moved to New York and I decided to get a ticket to go to the Integrated Health Symposium, which was basically like a 600-700 doctor symposium in New York. It was the biggest integrated medicine event there at that time. And I went and I was like, oh, this is interesting because up until then, most of the people I were working with were like acupuncturists, chiropractors. But now I saw like there were lots of physicians here. And I heard Jeff Bland give a lecture. And because I'd heard about him, but I'd never seen him or heard anything about him. And I sat in the back and I was like, this sounds like it's operating at a level of science that the doctors would get and want to be part of. And he was really hitting in some of the key issues with cardiometabolic disease and type 2 diabetes and heart disease and all these big killers that were, driving health costs. So that was the moment that I was like, okay, this guy's interesting. And then it was 2 years later at the same conference where I sat in with a lecture with Christy Hughes, who was a big trainer for the Institute for Functional Medicine. And that was a sort of a training on the functional medicine system. And then I realized at that moment that functional medicine had a real shot at being an agent of transformation in a way that these other medicine names didn't, mainly because there was a system where everyone did it the same. And that's what I was really looking for as far as like someone who thinks about scale and thinks about growing up. Like in my experience of going around to these hundreds of different clinics, actually thousands of different clinics, I made 40 outbound phone calls a day for 5 years. So I called everyone. And what I found was there were a whole army of practitioners all aiming at the same thing, which is to get people off medication, to get people well, to have people be sort of independent of their care. And all of those things had a lot of things in common, but they all spoke a slightly different language and they didn't really understand each other. And it was really actually hampering their ability to connect. And most importantly, the patient was confused, right? Because the language was just all over the place. And so when I saw functional medicine, I was like, hang on a minute, like there are things here that are consistent amongst all providers. The timeline, like everyone takes a detailed history, right? So a detailed history, this timeline piece here. There's the like fundamentals of health creation, the things that you can do to improve your health, like eating, sleeping, exercising, stress, and community. And that was in there. And then there was some sort of like agreed upon structure on how the body broke down. And I think that was really important too, because ultimately people started to, one thing that functional medicine really sort of engaged me on was, it's pretty obvious to me anyway that like you have, and this is actually an economics concept called, quality adjusted life years is based on this concept, but like everyone starts with health 100 and then when you die, you're at 0. And at some point on that continuum, you get labeled with a disease, normally let's say 30 or 40, let's say out of 100. So there's this gap between 100 and 40 where you've got no disease name and you haven't been categorized and put into the system, but your trajectory is definitely towards death. And, you could arrest that number and go back up to 100 potentially, but you have to do things differently than you're doing before. And so I saw this group of practitioners has the potential to go up, but like they're not using the same language. No one's really like laying it out as even as simply as I did just then. It was all a lot of like words that were hard to understand. It was quite esoteric. And so that's when I realized, okay, functional medicine, I think is where it needs to be. And then in 2013, my partner and I, we've been doing tiny events for 7 years, like in yoga studios. And we worked out a few things in those events that led to the Functional Forum, which was the show that I started, being a hit on the first episode. And it was a sort of a 90-minute live show hosted by me. I curated all the different speakers. And it was really a meetup in New York for doctors that were interested in this topic. And, by the 4th episode, we were streaming live. And, we're 77 episodes in today. We've been doing it the first Monday of every month for almost more than 6 years.
So you saw the potential of functional medicine. How did you see yourself at that point? Like the person who you now are, or that just took time?
Yeah, no, I've thought about me being this person right since the beginning, honestly. Like my feeling hasn't changed. And my wife will tell you, like in 2012, I'm sitting at home like frustrated that no one knows who I am. I haven't really done anything of any sort of reasonable structure. Like I really wanted to try and be of service and make something happen. And I could see that it needed to happen. I could see that I had the pieces and it just hadn't come together yet. So I've always seen myself in that way. Our goal with the Functional Forum was to make it cool and aspirational to want to practice medicine like this. That was the goal. Because Gabe and I, I guess we felt like we were cool. Like we listened to cool music, we're into cool stuff. And so we wanted to make it. So, the intro music was the beginning of the Daft Punk intro for that day. We had to scrub it off the internet because then we didn't get banned. But I had like awesome intro music, and we used all the hashtags, and we were just trying to do what we could to distribute the content, out to all the different places where it needed to go. And so, that was the beginning. And I don't think it stayed as cool over time because I've had a lot of other things to do. For 2 years, that was my jam. And I just did that all the time. And I would spend ages picking the right song that people would come on to, just like a batter in baseball comes on to like their song. I wanted to just make it a real experience to participate. After 2016, it just became one of 10 things that I was doing. And so, we've still been consistent on it. I hope to bring back some of that showmanship in the future, but I feel like I really have more of an idea now on what it takes to move the needle. And after 2 years of just getting eyeballs on the show, I realized like we got to do more. Like we got to make it happen. We got to like really get in there with doctors and help them to make the switch to functional medicine. So it's cool to be a functional medicine doctor, but how are you actually going to like switch your practice across and actually do it? Like, so our metrics went from, hey, how do we get the most eyeballs on the show to how do we get the most functional medicine doctors? And now the new metric all these years later is how do you get more people to have access to this operating system and use it and get better? And so I think our metrics, our sort of internal key performance indicators have moved along as we realized, okay, this is good, but we want to go bigger. We want to have more impact. We want to change more people's lives. We want to actually change the system. And so even today, I'm in a lot different position where I see what can happen. And also, people are starting to realize, I guess, that my ideas are good. And so, we're starting to get a lot more partnerships and traction and organizations thinking, hey, this guy's like onto something. Maybe we should like try and partner with him in some way. And that's been kind of the last few years.
Yeah, so let's talk about those 3 steps. First, eyeballing the new paradigm, then empowering people to start doing it, and then really giving impact and scope. What are the key steps in getting eyeballs into this new way of thinking?
For doctors or for patients?
I'd say both.
For doctors, it's a little bit tricky, right? Because doctors are busy. Right? Doctors have a lot of stuff going on. They're seeing patients all the time. The first iteration of doctors who came into this medicine came to it because of either themselves or a family member getting sick and realizing they didn't have the toolkit to get that person well and realizing they needed to expand their toolkit. And that's literally the first 1,000 doctors doing this all have that pretty much that same story. Jeff Bland is like a savant who could just think it, that it was, and saw it in the literature and his nutrition biochemistry, but most doctors, that was their journey. I think in the last 5 years, we've seen a sort of a doctor that wants to get out of the rat race and wants to like control their own destiny and doesn't want to take insurance and wants to just have a real relationship with his patients. That's the new group that's joining functional medicine because they're like, yeah, this is like part of who I am and part of what I want to be. So that's a big piece. And then, now I think there's a really incredible opportunity right now because healthcare is shifting because so many of these doctors are out of business in America because of COVID. And so I think just in the next 6 months, there's another opportunity to really go after doctors and give them a pathway towards practicing in this way. And that's kind of where we are now. So that's the doctor side of things. And also, I'll go one step further before I come back to patients, systemic change, right? So there's a lot more now examples of systems using functional medicine, like the Cleveland Clinic, like Adventist Health, where these organizations are realizing we can't solve problems that we have with the way that we're doing it, and we need to think differently about how we're doing it. And all credit to people like Mark Hyman for beating that drum for years as to systemic change and what it takes to do that. And the Cleveland Clinic is a great example of what's going on there. So I think there's some progression on that end. And some people change because they want to be leaders, like the Cleveland Clinic, right? Who want to be cutting edge, and so they do new stuff that no one else is doing because they have a reputation for that. Some people do it because it's just part of their like ethos ethos. So Adventist health is based on the Seventh-day Adventists. That's like a blue zone in the Los Angeles Bowl, right? So they're all about community. They're all about health. And so, they have their reasons for doing it. And then some groups are starting to look at it because they realize that for the first time in a group-delivered functional medicine, which is an innovation I wrote about in my second book that came out in January, that actually it could be profitable. And one of the things that has held back systems from adopting this kind of medicine is that it was quite hard to work out how to make it profitable because of the long appointments, and there's not that many doctors doing it. It's hard to recruit, and it's hard to bill insurance for it. So that's on the systemic level. And then on the patient level, there's been a lot of people doing quite a good job of getting the word out. Mark Hyman has 13 New York Times bestsellers. There's been best-selling books in every niche of functional medicine, gut, hormones, brain, all the way down. Summits, teledocumentary series, peer-to-peer networking models, like all of those things, and social media have created a structure where the word has got out. And that's why, look, in 1993, a third of people took supplements. Now it's like 70%. Everyone kind of realizes that, that if you stop watching TV, which is sponsored by pharmaceutical ads, that you can create health by actually eating healthy nutrients, and it's not rocket science. And so I think we've seen, some growth into the market at this point. Ultimately, though, what it's going to take to really transform is to connect people who aren't really consumers to it. And the people who aren't really consumers is kind of like the lowest 40% on the socioeconomic ladder who don't really get to make choices, right? It's not a lifestyle thing that has made them sick. It's the fact that they can't get water and they have to live on Coke, or, they don't have a healthy grocery near them, or, there's 15 fast food joints within a walk of their house, but nowhere to get a salad, and the salad is 5 times more expensive than the burger. So those kind of like systemic issues are what is going to be needed to change the system, and that's sort of like the final bastion. And I think that but there's people starting to really talk about what it would take to do that, and I'm more hopeful than ever that a lot of smart people are kind of thinking what could happen for that to be a reality.
Tell us a little bit about the Cleveland Clinic adopting this new possibility and putting their name on the line by trying it out as the first big health institution to do so.
Yeah, so I'm actually quite connected to this in a really fun way, in that the 4th episode of my show in May 2014, I had booked Mark Hyman to come on. And the story about how I got him to come on is legendary, and I'll tell you it some time. But put it this way, I had to become like a chauffeur and pick him up at the airport and convince him in the car ride that he should come and speak on the show. But anyway, I did, and he came, and he announced the Cleveland Clinic Center for Functional Medicine on the show, and for the first time ever, the streaming worked. Right. So we had 8,000 people watch the show, and we're like, oh my God, there's going to be a Cleveland Clinic Center for Functional Medicine. It was amazing. And so that was the first piece. So then it started small. They had a couple doctors, and Mark moved to Cleveland, and, they started doing it. And in 3 years' time, basically it was way too busy. They had 2,000 people on the waiting list, and they couldn't fill quickly enough. And it was, all the same problems of doing functional medicine that have been in any system, which is not enough doctors. They couldn't really ratchet it up fast enough. And you think the kind of people that are coming to the Cleveland Clinic Center for Functional Medicine is chronically ill people. So the next thing that happened was Tawny Jones, who I featured in my recent book. She was the sort of manager of the whole thing. And she decided that they should run these groups, 10-week groups run by physician assistant, health coach, and dietitian, where it would be sort of like a prerequisite to see the doctor. And if you made it through those 10 weeks and you charged on insurance, then you could go and get to see the doctor. And ultimately that they were going to sort of do a lot of the heavy lifting of the lifestyle in a group without the doctor. And it's a smash hit. It couldn't be more awesome in terms of the results that have yet to be published, but I've seen the raw data. I mean, half the people completely transform their health, lose all their diagnoses and get better. One, because you're solving the biggest determinant of health, which is loneliness. You're introducing people who want to get healthy to each other, creating new communities that are empowering. And then 2, you now have a structure whereby which people can actually ongoingly activate healthy behaviors. And that's the biggest deal for me. Like, that's a real game changer, where now you have sort of like 15 or 10 or 6 free accountability buddies, where you're able to go through a process with them of learning to be healthy. And I think that's really probably the biggest piece of all, is just having a structure where healthy behaviors become the norm. And so that's what's happened. So the results are amazing. It's called Functioning for Life. It was just about to launch when COVID hit, and I expect it to come out very soon, and it to be like an engine for adoption of these ideas into the system.
So I'm curious about your last book, The Community Cure. So you put together all these ideas about the power of community. And once you put it in a book, it seems like it's already a solid topic and a solid subject and a solid tool. But before the book, we had these papers and we had these doctors all over the country. They didn't come together in the same place. So the question here is, what was the process of writing the book? And how do you think that a book that puts all this knowledge into the same place really can be used to escalate this, both in the medical and the just general public?
Well, so in 2018, I went back to the Cleveland Clinic and I saw them doing the groups. And so I was like, oh man, that was awesome. Because I'd heard about group visits even 5 years before, when I spoke before the Functional Forum. I had heard about group visits, and I thought it's a great idea because I see that now maybe like poor people could really access this kind of care. And then, so then I came back after that experience. I was like, what shall I do next? And I was like, I'm going to write a book on group visits. Or maybe I hadn't decided I was going to write a book. What I decided was I wanted to meet everyone who was already doing group visits. So I put out an email to my list, and I was just like, hey, anyone who's doing any sort of group medicine, I want to hear from you. And I got maybe a dozen responses from people, and I started to record podcasts. So we made a series called the Group Visit Series, where we have 13 episodes of people doing different innovations in groups, in systems, in primary care, in, whatever that looks like. So we did that, and it was a great success, and people were really into it. The first interview that I recorded was with someone everyone had said, hey, you've got to meet Jeff Geller. You got to meet Jeff Geller. He's the man. He's the godfather of the integrated medicine group visit. So I interviewed him, and the first call I had with him was so good. I was like, this is the book. In fact, because I could realize that he was an incredible hero for the book, because this is a guy who had basically been doing group visits in like the poorest parts of Massachusetts and helping undocumented immigrants like create resilience and health by just being with each other and engaging in healthy behaviors. So as soon as I did that interview, I was like, okay, I know this is the book. And I just followed the same formula from my first book, which is really a hero's journey sort of methodology. My goal with the first book was, could I give it to a doctor, and at the end of it, they'd be like, yes, I want to practice like this. And then the goal with the second book was, if I handed this to like a hospital administrator, would they read it and go, wow, we should definitely be doing this in our clinic? So that's kind of, that's the journey of the book. And it was awesome to do it. I really enjoyed meeting all the different people. It's amazing like that. What was in chapter 7 of the book, which was the future, is now the present because of COVID. So virtual group visits, remote patient monitoring is the sort of the newest thing. And I think it's pretty cool.
How do you see the fact that we need to put these tools, the community cure and functional medicine principles and all these things that you so eloquently talk about and have proven that it works in so many levels in education, in the first years of medical education? Is that something that we see in the near future for the US at least, or it's still very rock solid, the curricula that they are still offering?
Look, I'm a bit of a contrarian on this because I'm not a doctor. I actually don't care about medical education. Like, I think it's cool and good luck. It just like seems like it's going to be the slowest thing ever to move, because you've got, people have to die before you can change the curriculum, right? You've got all these tenured professors and they come up with a curriculum and they've been teaching it the same way forever. It just seems like that's going to be so slow. I feel like where the real juice is, what is a health coach, right? You may have heard that terminology. What is the difference between a health coach and a doctor, right? A doctor has 10 years of training, super specialized, really really there and was the whole of medical education was created around, diagnostics for, instant diagnostics for people who are really sick, right? You come in with an infection, you've been hit by a bus, you want a doctor who can come in, call the shots, make it happen and save you. That model for chronic disease is a horrible, horrible, horrible failure, right? Because the doctors don't know anything about what causes it. They don't know how to change behavior. And they're just not trained to do it. And a little training in nutrition isn't going to do it either. I mean, you're literally talking, but the difference between acute and chronic disease is so massive, right? That one doesn't just change into the other or just evolve into the other. You're literally talking about the opposite plan, right? The opposite of the doctor coming up with the plan is the patient coming up with the plan, right? And so the health coach for me is this interesting position because typically a health coach, one, has recovered from their own chronic illness, right? You don't just become a health coach because you're into health. I guess some people do, but most people burn out, get sick, work out how to get themselves better, and then I learned a lot. I should be teaching other people to do this. So there's a really powerful force there in having a peer-to-peer relationship with someone who's actually done it. That's a big deal. And then the second is, look at on the fundamentals of health creation in functional medicine. How do you actually create the right accountability and support structures to help big groups of people make that transition? And I feel like the health coach is the key. So rather than expecting that the doctor's going to miraculously turn into an epic health coach, why not just put health coaches on the front lines of chronic disease? And if the doctor needs to get involved, that's great, right? We can use the functional medicine doctor when the lifestyle alone has not led to the change that the patient wants to see. And that ultimately, with exactly the resources that we have today, right? We don't need some change in medical education that might take 20 years. With exactly the resources that we have today, we could transform the system. It just means, I guess, think about it this way. Think about how you would end up in conventional medicine, how you would, if what you really need is a health coach, someone who could hold you accountable to doing the things every day that you need to do to be healthy, right? If you really need that, think about what process you have to go through in order to be prescribed that in the system. Step 1, go to a primary care doctor. Step 2, get a drug. Step 3, get another drug, 5 steps in there. Step 6, go to a specialist. 7, another specialist. 8, another specialist. 9, to another new doctor. 10, 11, 12. Step 15 is you go to a functional medicine doctor. The functional medicine doctor puts you on their functional medicine protocol. Step 16, he finally asks you the question, hey, what's going on? You said you wanted to get better. I gave you this great protocol. Why aren't you doing what you thought you were doing? Oh, well, whatever the answer is, typically trauma, right, is driving people's behaviors. And guess what? What I just described is unbelievably traumatic. So then now, 17 steps later, you now get paired with a health coach somehow, some way, and you've already spent thousands of dollars over here on all the co-pays and drugs and all the other bullshit you never needed. And now you've got the health coach there, and you get into a process, you start doing the healthy behaviors, your labs start getting better, you start being in a better mood, you start improving, your relationships improve, all of these things. And the whole thing is we could just disintermediate the whole thing, disintermediate all those other people that did nothing to help me get healthy, and just start with the health coach. And just have that relationship of someone who's been there, who's reversed their chronic disease. That to me is not that that's not that crazy of an idea. And ultimately, that's my vision for chronic disease management. Start with the health coach and follow a principle called the naturopathic therapeutic order. All it says is we start for chronic disease, we start with the least costly, least invasive interventions first, and move our way up towards more costly, more invasive interventions like drugs and surgery last. If that doesn't make sense to you as a human, you obviously haven't seen the results of, how many people are caused harm by the medical system. If that doesn't appeal to you as an economist, you don't have to be an economist to realize that we're spending so much money doing all the wrong things that are completely inappropriate. And ultimately, this is just an idea I feel that time has come. And I'm going to tell everyone until I'm going to do this for 30 years until people get to realize that if we want to create health in the population, we need groups, we need health coaches, we need technology, and doctors can be there for everyone else. Like, we don't have enough doctors anyway. We have a shortage of doctors. So let's just get the other people in the right place and let them do their doctoring. We'll have less harm, we'll have better results, and it'll cost less.
That's so eloquent, and I'll be there for you to support you in that endeavor. Definitely very clear vision. And if we're going to walk that path of demedicalizing health, and it's not really about the doctor, but about the person, we need to think about how to broaden our definition of health and wellness. Because we just, traditionally, we think that the person who knows more about our health is our doctors. And now we're seeing that that's really good for the acute part of the problem, but not for the chronic and the just health creation in general. So how can we broaden this definition? How can we harness the power of this new wave of doctors who are really understanding this, but going further and not only relying on doctors to broaden this definition?
Well, I think it's starting to happen. It's not really, it's starting to happen kind of by itself. I mean, you see big organizations starting to realize that they're going to have to implement changes in the social determinants of health to change health, which is a big step. Now, how they do that in an affordable way is still, I think, a bit of a mystery. In my book, I showed how group visits can be a really effective way to help people solve each other's problems, right? So it's not just like help from on high, but it's actually facilitating communities so that problems can be solved dynamically by the group itself, which I think is certainly a part of the plan. But yeah, I mean, ultimately, I think what COVID shows us is that people that look the same have a dramatically different response to the same stressor. And one of the concepts that I talked about in my book is this idea of moving to kind of what they call precision public health. So rather than focusing on things that are good for everyone, the average human, focus on creating lots of healthy individuals. And how do we do that? We need people to participate. And that can be facilitated through technology, coaching, or groups. And ultimately, we need to do that at the most obvious level possible. And you don't have, I don't know what the thing is in Mexico, but I certainly feel like the government has a potential to play this kind of role. I think you could have this kind of content on TV. I think you could have content like, you're seeing efforts already now to find ways to use social media to get the word out. I mean, David Katz, who I had a chance to listen to, who's I think been one of the clearest thinkers when it comes to COVID. He shared that we really need like a national Get Healthy campaign. And I think that we saw by everyone staying at home for months and months on end, how willing people are to do things that are new because of helping their fellow man. And ultimately, we need to harness that kind of energy for a worldwide chronic disease reversal campaign. You'll see that, the philanthropists that are at the center of this health thing with COVID, there's one area of health where they never seem to really get involved, and that is empowering people to reverse their chronic illness. And if you look at all of the information that's put out, all of the efforts that are done, it really never looks at social determinants of poor people. If you start to, that's really why. And so, ultimately it will take, I think, a combination of other philanthropists, government, and then just actually communities themselves. And one of the things that I shared in my book, there's an economist called Raghuram Rajan. And he was the IMF head economist for years, and I think he's the head economist in India. He wrote a book called The Third Pillar. And he said, look, we always think that it's up to either government or markets to solve these problems in all areas of health, in all areas of the world, but particularly in healthcare. And that couldn't be more obvious than in America, right? We have Democrats who are like Medicare for all, and Republicans who are like, the market will solve the problem. But truly what he advocates for in his book is the reason why we only see that there's two options is because this third pillar of community has been decimated by technology. And that ultimately all of the best solutions that are the best outcomes at the lowest cost revolve around groups of people coming together to solve each other's problems. And that's the clearest that I can make it as to what has to happen.
I love it. So in Mexico, we're beginning to really talk about these issues in a bigger community. What would be your best advice for us that we're starting this conversation in a more communal, organized, standardized, knowledge and motivation-driven conversation?
Well, look, at first, I think you have to find a way to bring the change makers together. right? To put people in the same room. It's really amazing to look back at the functional forum and see, relationships that were created in those early forums, what those turned into 5 years down the road and what impact those things had. So I think getting community together to introduce people who want to be part of the revolution to each other and really getting clear as to what that looks like, coming up with kind of like a real, alignment documents about what they kind of change they want to see. And then I think from there, it's about using the three structures that we've spoken about: technology, coaches, and groups, to be able to facilitate the most amount of health. And I think those things are not unique to Mexico. Those things are the same. Mexico has some unique issues, right? Mexico has some unique vulnerabilities. Mexico has some unique strengths. And I think coming up with a plan that plays to those strengths, like the plan that would be the plan in America is different than the plan in Mexico. I mean, America has one functional medicine doctor in every town. So it's, they've got more of an ecosystem by which to do something at scale. Mexico may need to start a little bit smaller, but, if there's one thing that's happened during COVID is that everyone realizes that telemedicine kind of respects everyone's time a little bit more than standing in the waiting room. So I feel like, you've got the right fundamentals. It's about, bringing team together of people who either care enough to be, in this space themselves, and to bring those people together and to look for co-creation, efforts of co-creation. That's the first step. And then it's really about charting a course forward that will, try and achieve the goals of the group.
One thing that I've seen is that people that come together into this revolution, as you said, really enter in a way and evolve dramatically right away as a community and as a person. So the question is, how did you change in the past years because you were in touch with this information in this community, and how you've seen other professionals, doctors, and people in general who are touched by this new way of thinking and engaging, and how their lives have improved because of it?
I did a tour. I did a 26 city tour in a bus with my family in 2018. I wouldn't recommend doing that. But what I would say is that every moment on that tour, I was inundated with people whose lives have been, profoundly changed by functional integrated medicine. And, there were things that I would do differently again if I could do this whole thing again. But one of the things I definitely wouldn't do differently is made the forums and built the practitioner communities, because it's meant a lot to a lot of people. Just here in Sacramento, hearing doctors say that they got the confidence to practice in this way without being shunned by all of their peers, because they had a couple of other doctors to run past cases with and say, hey, I'm seeing that this person's autoimmune antibodies went away when I changed the diet. Are you seeing that? And they're saying, yeah, I'm seeing that. Whereas, the immunologist is like, what? And the family medicine doesn't get it, and primary care doesn't have time to even understand what you're saying. So, that there's reinforcement of the power of community to support growth. So, yeah, look, it's affected a lot of people in a lot of ways. The most profound changes are where people reverse their own chronic disease. Because once you go through a process of reversing your own chronic disease, you have no doubt as to who has the strength and who has the sovereignty in your life, right? Because you just reversed your own chronic disease by doing those things right. And so that to me is the biggest shift, is that once people reverse a chronic illness, they never think the same way again. And either we're gonna have to wait for everyone to get ill and then do it, or hopefully we're gonna have to be able to go a little bit more upstream. And that's the goal for the next 10 years. Let's reduce unnecessary suffering as much as possible.
What's your next book about, if you can tell us?
I don't know. I haven't got another book. I don't know. I thought about writing a half autobiographical, half science fiction novel. So I don't know. It hasn't started yet, though. It's a bit outside of my box. But I don't know. We'll see. I wrote an ebook recently that was focused on this thesis that I have for transforming chronic disease care around coaches and groups, and sort of not putting doctors as the first port of call, even if they're functional doctors. And so I just wrote an ebook about that you can find at findfunctional.com. That was really just sort of like a little effort at the thesis. I don't really think I'm going to write another book for a while, but I guess one of the things that I see, one opportunity is that, that America may not be the most obvious place for this revolution to occur, right? America's got a lot of problems, but it's a good place to try new things because there's so many problems that solutions can be useful. But I look to somewhere like India, Victor, where you have 1.3 billion people, right? So a sixth of the world population. You have an energy and a history of spiritualism and divinity and reverence, and you have a culture that was based in that. Then you have, a healthcare system, a new sort of creation of wealth. And I made a trip to India in March. I was invited out there by a guy who started a company called Organic India, which is the biggest biggest supplement company probably in the world, I think, at this point. He started, 20 years ago. And he's got a big vision. He read my book and he liked it. So I would rather not write any more books and spend the next 10 years executing the ideas in this book. Because ultimately, if the ideas in this book are executed at any meaningful scale, the ripple effect will be transformational. And so let's say no books.
Sounds good to me, my friend. What advice would you give me now that we are starting this podcast and we're bringing this community together in what we're calling Back to the Future, transforming health and wellness?
I think one is to just bring people together. I think it's the thing to do, and even more needed today than it's ever been. There are all kinds of ways to do it, but just like looking to find ways to create commonality between people who want the same thing, I think is huge. The second is there's a lot of wisdom in like the pre-Spanish Mexican culture. And I think that finding ways to access that kind of wisdom, can make a uniquely Mexican offering where it's not just, there's a whole Mexican tech world that's really exciting. But what is Mexican culture? Like, is it the Spanish Mexican culture? Is there a pre-Spanish Mexican culture? And what does that culture know about health that this culture has got drastically wrong? I think tapping into some of that will allow you to bring people back to sort of an inner knowing about what they're here to do. And secondly, to base something on something that everyone has they should have some reverence for. So I think those would be the two things that I would, as a starting point. And then I would say that the thing that I found that I would say is think big, right? We need people who can think big. We need people who can think, okay, I want to drastically change the health of the Mexican people in the next 2 decades. I love that. I think it's Tony Robbins' quote. He says, we all overestimate what we can do in 1 year and underestimate what we can do in 10. I'm 15 years into it, right? And I see what's happened already, and I'm not even 40 yet. So I'm still I'm in for the long term. So I'm excited about what we can do in my lifetime. And I know that you're excited about what's possible in Mexico.
All right, James. So thank you so much for this interview. I can't tell you how much of an example you are for me in personal terms, but also in inspiring a lot of people all over the world to really delve into this and really think deeply about the implications of daring, of dreaming this big, both for ourselves, our families, and our communities and societies. So thank you so much, and I hope to be in touch.
I hope so too.
Have a great day.
Thank you.